Hello, everyone, and welcome to our first Teacher's Corner. Today, we're going to be talking about fetal alcohol spectrum disorder. I am Frances Echeverria, and I'm a mental health consultant with the Early Childhood Council. And I'll let my other two colleagues introduce themselves.
Hi, I'm Catherine Trujillo, and I am an early childhood mental health reflective coach at the council as well.
Good morning. I'm Deb Benali, and I also am an early childhood mental health consultant at the council. I'd like to welcome everybody.
Yes, thank you for watching this. So we hope that you will learn some strategies that you'll be able to use in the classroom and just get about an understanding of the kiddos, some of the kiddos that you may be working with. So we will go ahead and get started. What is FASD? So again, FASD stands for fetal alcohol spectrum disorder. And it is an umbrella term for a range of disorders that can occur when a woman drinks alcohol during pregnancy. It is not a specific diagnosis, and the problems can be physical, mental, or behavioral, and they can range from mild symptoms to more severe symptoms and in between. So why are some women more likely to have an alcohol-affected child? Some women don't know that they are pregnant and may not find out until they're 4 to 6 weeks along, and or even past that, and so may have had some drinks during the time where they were just unaware that they were pregnant. There are also mixed messages that a lot of women and families are getting. So some people, receive mixed messages about how safe it may be to drink even, a glass of wine or one glass of alcohol during pregnancy. So maybe, some women are kind of confused as to the validity and how safe it or not, how unsafe it actually is. And then some women may use alcohol to relax, de-stress, and just deal with everyday life. So they use it as a coping mechanism, perhaps for depression or anxiety, and may have little outside support during their pregnancy. So FASD is the result of brain damage caused by alcohol and what it does to the developing fetus. So alcohol is really a poison to the developing fetus, meaning it causes malformation of the fetus. So in the background, you can see 2 brain scans, and on the right would be a fetus that has been exposed to alcohol during pregnancy. And then on the left is a brain not exposed to alcohol. So you can see that there, really is a big difference, and it can have huge effects on the brain. So possible outcomes for the mom could be a miscarriage, preterm labor, preterm birth, or stillbirth. And for the child, the effects on a developing fetus can be permanent and will last a lifetime. So again, the effects really can range based on how much alcohol the mother may have consumed during pregnancy, at what stage the mother consumed the alcohol as well. But for the kid, the outcomes can include low body weight, small head size, poor coordination, learning difficulties, speech and language delays, vision and hearing problems, difficulty with attention, poor memory, and lack of focus. So as you can see, there's a whole range of possible outcomes that this kiddo can experience if the mom did use alcohol during her pregnancy. So again, these are more symptoms and outcomes that an FASD child might have. So again, it really can vary, and there's a range, and but here we see more learning disabilities. You have physical disabilities such as problems with the heart or the kidneys. You can have vision or hearing problems, sleeping or sucking problems as a baby, which can again result in other physical symptoms, intellectual disability or low IQ, difficulty with attention, poor memory, and a lot of difficulty in school, especially as they get older, when that attention is and memory is really needed to be able to understand and get what's going on. But again, this just shows there's a really wide range of symptoms and that a child can experience. And these in the classroom might be some of the signs of the challenging behaviors, that hyperactive behavior, the lack of focus, the lack of what seems like lack of memory. So yeah.
These are some of the facial features that a child exposed to alcohol in utero may have. Not all children that have fetal alcohol syndrome have these features. A low nasal bridge, the folds in the eyes and the nose, the thin upper lip, it's smooth across the top. The head is smaller. The bridge of the nose is lower. Just a lot of different facial features that you can notice. The jaw is smaller. So those are some of the things that you can look for if you suspect maybe fetal alcohol. But again, I want to say, not all children that have fetal alcohol syndrome have these facial features. The most important thing to remember when teaching a student with an FASD is that the child has the capacity to learn. There are 5 keys to working successfully with students that have an FASD. Structure. It's very important to understand that students with FASD lack the ability internally to have a structure. So the more structure externally you can put around them, the better it is for them to learn. Consistency. You need to be consistent in your responses and in your daily routine to that child, so that that child has a sense that their surroundings are predictable and they can depend on what's going to happen. Variety. You should also use a variety of ways to get and keep the student's attention. Brevity. Students with an FASD have difficulty maintaining attention, so it's very important to be very brief and concise with your directions and your explanations. Persistence. The most important thing to remember when you're working with a child or student with an FASD is to repeat, and repeat again what it is that you want them to learn. And then you may have to repeat, and repeat again the very next day. Okay. Next slide. This is from a parent of an FASD child. The part of the brain that passes information between the left side, which is our rules, and the right side, which is our impulses, may be damaged or absent with FASD. So that's important to remember when you're working with a child that you suspect or may have an FASD. My child is sometimes sensitive to fluorescent lights, tags on clothing, visual overstimulation, noises, smells, etc. So watch for sensory information that you're getting. My child can be very emotional and often has a low frustration tolerance. My child might have a hard time sitting for a long period of time. Because of his FASD, my child may often act half his age. My child may exhibit poor judgment. This is from the damage to the frontal lobe of his brain, and because of this, he needs supervision and lots of reminders. Kindness and redirection. Kindness and redirection is far more effective than punishment. And as teachers, remember that. Kindness and redirection is far more effective than punishment. My child has problems with self-regulation and may need a quiet time and space to calm down. Cozy corners are real important for children like this. They need a space where they can collect themselves. Memory issues are very frustrating for my child. Repeat and repeat with compassion. My child often has trouble sleeping. Please understand if he is tired. Time is an abstract concept, and my child does not feel like you and I do. Real important things to remember from a parent of a child with FASD. Next slide. Planning for the student with an FASD, starting with the environment. Use calm colors on your walls and bulletin boards in the classroom. Reduce the brightness of the lighting in your room. Have pets and plants in the classroom to help your students relax. Keep the seating assignment consistent all year long. Free up the classroom for any unnecessary distractions or stimulations. To reduce visual distractions, materials not in use should be stored in boxes or cupboards, not on the countertops. To reduce, I think I might have already covered this, but to reduce visual distractions, store your materials in cupboards, not on the countertops. And because children with FASD are not always able to block out other noises, allow students with FASD to use headphones for quiet time so they can actually retreat from the noise and the stress of the classroom.
So all of our wonderful educators, Deb is actually out enjoying summer right now. So I think her internet's a little unstable. So just to let you be aware.
Next slide. Communication strategies. Gain the student's full attention before communicating, face to face, and use their name. Be concrete in your communication with the student. They have trouble understanding abstract concepts. The student may shut down with too much talking, so be brief and concise. When providing instructions, give one step at a time and then check for understanding. Have the student repeat information and reinforce the learning as needed. The student may need to be reminded of the steps frequently. So go back and ask one step at a time, and do you understand? Allow the student time to process after asking a question. Recognize and honor the student's communication attempts, and use music activities and physical activities and art activities to help teach vocabulary. Okay.
So we're now moving into executive function. Younger students do well in a very structured environment. Create a picture chart and work through these questions with the student on a regular basis to illustrate the importance of problem solving. Model. Teach and practice self-talk that encourage students to stop and think before acting. Work on teaching empathy by having the student take another person's point of view. Use role-playing to illustrate specific examples of when impulsive behavior can have an impact on those around the student. Take the time to teach coping strategies, such as relaxation techniques, for these students, and cue them to use the techniques. Teaching the student to recognize his and her emotions. Break tasks into smaller, manageable steps to avoid frustration. Use books and characters from literature to help the students understand how their feelings affect them. Meeting physical needs and avoiding overstimulation. Students may need several rest breaks throughout the day, and some students may need to take a nap. Students may need snacks during the day. Observe the student for any health problems, including physical and mental health. So this is really recognizing when they come into the classroom. Maybe they had a rough morning before they got to your room, to just be aware of that and make sure that you're paying attention. If they're grabbing at their ear a lot, maybe they have an ear infection or something's bothering them. When the student's behavior escalates, keep a normal or a softer voice at a slower pace. So if you are escalated, it's gonna encourage them to get escalated. Some students are calmed by background music or the sound of a fan. If this is disturbing to the other students in the classroom, you can allow the student to use headphones with the volume turned down very low when he or she is reading or doing individual work. Flexibility in shifting tasks or attention. Offer the student options for alternative activities as a form of built-in flexibility throughout the day. Announce schedule changes in advance so students have more time to adjust. And a good one for that would be 10 minutes prior to the change to give an additional reminder, and then maybe 5 minutes prior. Flexible problem solving can be difficult to learn. Spend time with the students modeling, teaching, and encouraging the use of flexibility. And I think their self-talk, go ahead and talk about what you're doing, say out loud what you're thinking, how you feel, so you can model that for them. Teach students that people are allowed to make mistakes, and offer examples through stories, movies, and real life situations. And making sure that we know that when we make mistakes that's a learning opportunity, but our children don't always know that. So we need to make sure that they understand that. And sustain attention. So use a stopwatch while the student completes a small task. This is actually little steps to make it fun and more engaging. So you would stop the time when attention is lost, then give the student a goal to try to focus for a longer period of time. So try to beat their time, right? Try to make their attention last a little bit longer each time and make a game out of it. Use games to overlearn rote material. It is important that these games are not competitive in nature. So we wouldn't want to compete against another student. This is just competing against themselves to make their own time increase. And this is our resource page, the National Organization on Fetal Alcohol Syndrome. There is a webpage that you can go to. And just keeping in mind, a team approach will help classroom teachers meet the complex needs of students with an FASD. And we would like to be part of the team that helps you with that. And so we have listed our information through the council if you would like to get a hold of us for more resources.
And thank you everyone for joining and watching. We hope that this gives you an understanding of what perhaps could be going on in this little kid's brain. And that it really is, something that is happening at the brain level, but there are strategies that as a teacher, we can absolutely put in place to help support them even more. So we hope you learn some strategies and just have an understanding. And yes, like Catherine said, please feel free to reach out to any of us for more information or to discuss any questions that you may have or anything like that. We're definitely here to help and support. All right, so thank you, and we'll see you next time.
I'd like to add one last thing.
Yeah.
Also, if there is a topic that you are interested in learning more about, or you'd like us to post on our page, also contact us and let us know if there's something you'd like more information about. We'd like these to be meaningful for you. So anything that you're wondering about or want more information, we would love to do that for you.
Yeah, thanks for adding that, Catherine. So true. We hope to hear from you soon.
Thank you.